So what options do you have then in dentistry? Well, we're super excited to share with you an amazing new product that does 3 essential things for patients. We created a product that has a blend of really effective essential oils to help us reduce the bacterial load in the mouth. It also neutralizes the pH of the oral environment, which is really important to minimize disease. And it also has a therapeutic dose of xylitol in it. And xylitol is a known cavity fighter and really well respected or understood in the dental community as to the power that xylitol can bring.
So let's break it up a little bit. Let's walk through the research that's out there on why it is that we've chosen the following essential oils to be part of this. So let's walk through and let's talk a little bit about peppermint, for instance. I know this is one of your babies, so you jump in and talk about your baby.
Okay, I love this study. So this was actually published in 1996, and what it was doing was studying peppermint. How effective is it really against really damaging, bad, mean bugs, as we've talked about? And so they tested the antibacterial activity of peppermint essential oil against 22 bacteria, including gram-positive cocci and rods and gram-negative rods, and 12 fungi. So, 3 of those were yeast-like and 9 were filamentous. So for those science geeks, you'll understand what that means. The rest of you just stick with us, right? So peppermint was found to be effective against all 22 of those bacterial strains, all 22. And that is really incredible. So another story about peppermint that was published in the European Journal of Dentistry, this study was aimed to find out, like we talked about before, how well does peppermint inhibit the growth of certain bacteria that are proven oral pathogens. And what they did was they tested more than just peppermint, but they tested 5 essential oils. And what I want to talk about is the results from peppermint. And what they found was, the conclusion of this study was that peppermint can act as an effective antiseptic solution against oral pathogens. That was published in 2013 in the European Journal of Dentistry.
Which is just fantastic. I love this little image right here, because what it's doing is it's showing us that in just a standard plate growth, and think of it this way, this little plate can represent the oral cavity very well. We're not talking about something that you're going to ingest that's going to be potentially modified in the stomach, it's going to be potentially modified throughout the body, right? The oral cavity is very similar to this plate experiment. So if you have bacteria that are growing or harbored in between teeth or in the tissue, they're going to be locally affected by this peppermint essential oil. And look at the difference between the growth on the plate and the areas in which it's been directly in contact with those compounds. Notice that whether it's eugenol or whether it's peppermint, the effect is devastating to those pathogens. I just think that it's such an exciting time that we have to be introducing these things. And I think over time we're going to find that these are going to become our new gold standard. So I love it.
I think it's awesome. So one more study that's really powerful, also published in the European Journal of Dentistry, was that peppermint oil can increase salivary flow. And this is very useful for patients with dry mouth. And so the study they also published that peppermint is a good antiseptic, antibacterial, and antiviral. It has a light, clean, refreshing aroma that we all know. It has a stimulating and strengthening effect in treatment, helpful for a lot of different uses. But because of those antiseptic and antiviral and bacterial properties, it's an incredible tool for us to use when we're trying to reduce the bacterial load. So patients that have dry mouth, it's been published by the Pharmaceutical Times magazine that out of the top 200 prescription medications prescribed in our society, 100% of those cause xerostomia or dry mouth. So this is a very real problem in our society, and peppermint has been shown to increase salivation, which is another key element, a key benefit to us as dental professionals.
Especially when you start referring to things like bad breath. When you dry that oral cavity out, boy, that's one of the things, if you want to come home and make sure you're there with your significant other at a time where your breath may not be so lousy, increasing salivary flow is critical.
Absolutely, and peppermint also helps with the breath in other ways, which is super exciting. So let's talk a bit about Cassia.
So Cassia is a very strong essential oil. It has a warm taste. It's actually considered to be kind of a hot essential oil. And the reason for that is the compounds that are present are going to kind of function in a slightly different way than peppermint. And so notice what we're doing. We're blending the effective nature of different types of compounds, maximizing their ability to reduce or involve different cell types in a healing way. So Cassia has been shown to be very effective when we're talking about wounds or wound care. So one of the things, if you look at the studies in general, what are we trying to accomplish? So one of the areas is we want to reduce pathogens, right? We want to knock these bugs out, but we also want to inspire the tissue to heal more quickly. So Cassia, in and of itself, is able to prevent these bacteria from communicating properly. So they're not able to form these little focused area of bugs that become more virulent, more difficult to eliminate, which means the wounds that are present then stay there longer. So what we're doing is we're preventing that growth of biofilm. We're preventing that ability for the bugs to even communicate. And we're not talking about a single form of bacteria. We're talking about gram-positive, gram-negative. We're even talking about in some of the studies where they're looking at MRSA or those types of bacterial colonies or species that have been extremely difficult for us to wipe out. And yet Cassia has been shown effective in reducing them.
Yeah, I love that. I love that Cassia has such a powerful impact on even the most highly resistant and tolerant strains of bacteria. Another study that I think is important for us to note was published in 2013 in an edition of Molecules magazine that showed that Cassia showed high antimicrobial activity for most of the tested bacteria that it was measured up against, but including Streptococcus mutans, which is huge for us in dentistry because we know it's one of the main culprits in causing decay. So here we have, you know, they said in the study that Streptococcus mutans is considered the main etiological agent of caries. So super important for us to know that it has an impact on that as well.
So it's not just, so think of it in this way. You take peppermint, you take cassia, you take clove, which we're going to talk about in a second. What we're really doing is delivering a mechanism that at any age group can be used to eliminate pathogens that are causing a decrease in wound healing, that are causing an increase in bleeding, and that is the actual culprit of dental decay. So we're actually providing something that can be used at any time to reduce, like she said, strep mutans. You're giving somebody a tool that they can use every day to reduce the amount of or onset of decay. That to me is absolutely awesome.
Right, and it does it in more than one way, right? We mentioned the effect of the bacteria, but also increasing salivary flow. I mean, that's what's so beautiful about these compounds is that they all achieve different things, but when we put them together, we really are creating a powerful impact in the patient's mouth.
So talk about clove a little bit.
Okay.
This is one of my favorite essential oils. It has kind of a funky taste in and of itself, but when you blend it properly, which is what we've done, I think it actually functions brilliantly. Right,
and it does have incredible properties. So we had to include clove in the formula because there's so many studies that show, I'm going to quote one from, again, the European Journal of Dentistry in 2013, studied clove as one of those essential oils that they studied. And they said that the study concludes that apart from traditional use of eugenol, antibacterial effects of essential oils, clove included, can provide an effective antiseptic solution against oral pathogens. So here we have this study published in a European dental magazine about the impact that eugenol and clove, of course, eugenol is a component of clove, they're very effective against oral bacteria associated with caries and periodontal disease. So that was published in that study, not just caries, but caries and periodontal disease. So that's powerful as well. And we know clove has also proven effective against a large number of other bacteria and viruses. Previous studies have reported biological activities of eugenol, including antifungal, anti-cariogenic, and anti-allergic, anti-mutagenic tendencies. So there's just so many wonderful reasons why we've included clove in this formula.
Yeah. And you know, it's interesting, certain essential oils or certain things that we want to think of in terms of generating overall health, think of it this way. There are food types out there that we have been taught are going to help our cells systemically to reduce things like, say, think of like free radical formation, for instance, where the cells become this like hyperactive molecule that wants to steal electrons away from other things. So clove, what's interesting is these compounds are not just antimicrobial, so they're not just wiping out the pathogens, but they're stimulating cell growth and reducing these free radical forming areas that are so prevalent in the presence of inflammation. So what we're doing is we're, of course, decreasing the pathogens like we talked about, but now you're getting decreases in blood, you're getting your pocketing depths are going to be a little bit more healthy, you're going to get much more rapid tissue regrowth, so you're getting reattachment of those ligaments. So overall, it's probably one of the most powerful compounds that I'm aware of that has been studied and shown to be effective.
And that's actually why it's been used in tribal remedies. For so many years, hundreds of years, they've used clove when it comes to oral infection and oral disease. So it's really exciting that we know more about how it's working and why it works and why we should be using it every day. Let's talk about the last one.
Okay, lavender. So a lot of folks would think of lavender only in the area of sleep or to de-stress or to calm themselves a little bit. It is extremely effective in those areas. But how many of you realized that lavender is actually really good at knocking out both fungus and bacteria? There are studies that have shown that lavender has a wonderful effect from a very cell stimulating, meaning it's good at inducing cell growth, but it's also good at wiping out those pathogens. I actually was amazed the first time I looked at the studies. I had no idea that lavender was that effective.
So when it comes to lavender, there's really a lot of studies we could share. One particular study showed that lavender oil killed 100% of Candida albicans within 15 minutes. And
that is amazing.
Incredible. We also look at a study about lavender and just the vapors of lavender wiping out MRSA. We talked about MRSA when it came to Cassia, but lavender also has a very similar impact. And I don't think it's necessarily a bad thing that lavender's also been proven to reduce mental stress, because think of where we are. We're in the dental practice. And so a lot of times patients do have anxiety and stress when they come see us.
I think almost everyone does.
Yeah, for sure.
It's been my history that people come in to see me, they're a little stressed out.
Yeah, well, that's because you do oral surgery and endo and all the fun stuff that we do in dentistry. But again, I think there's a reason for that. And reducing mental stress and reducing stress in general is just a nice side benefit of having lavender in the formula. So there's a lot of reasons why we included it. One other study that was published just in June of 2014, researchers reported on the anti-inflammatory effects of lavender, which is one of the key reasons we wanted it included in the formula as well. Lavender is being used as a treatment for asthma and a lot of things that are dealing with inflammation as well. So it's really awesome to be able to have all those properties added to the properties of clove and cassia and peppermint. And what we've tried to do is create almost like a perfect storm of compounds that can really have an impact, a dramatic impact on the health of your patients and really help them achieve, like we said, a better state of health by using a simple product.
Which can be used, like we've talked about, at multiple different age ranges. It can be used with people who are more compromised medically, meaning in the past you had to be much more careful about what you were giving them for an at-home regimen, because it can interact with some of the other things they may be taking or medications they might be on. So what's lovely about this is we're delivering a solution that's cross-platform, it's easy to use, and the different essential oil compounds all work in synergy and magnify each other's benefits and promote that rapid tissue healing.
So when you have a patient in your chair that's exhibiting some early symptoms, right? Gingival bleeding, redness, inflammation with the gums. Sometimes these people are also the same ones that are at risk for decay. They've got reduced salivary flow. They may have compromised health in other ways. They may be diabetic. They may have heart disease. They may have other things that their immune system is fighting. The beautiful thing about this product is it works for all of them. Right? So we're seeing dental hygienists and dentists using these products, using this mouth rinse and spritz and the combination of products we put together for patients who have more than one threat. High risk for decay, Essential Smiles. High risk for periodontal infection, Essential Smiles. Early warning signs of infection and inflammation, it's having a really great impact, which is a really exciting thing.
Patients who have told us that when they come home, their wife or husband turns their head and won't kiss them, Essential Smiles.
That works too. And one of the reasons
That's called home happiness health.
And let's take just a minute too and talk about the xylitol component within that, because again, this is another compelling thing that we wanted to include when we were looking at the formula, is a way that we could use the natural impact of xylitol. Xylitol has been called nature's cavity fighter, and it's derived from the sugar from tree bark, as many of you know. And what it does is it deactivates the bacteria from converting the sugar in the mouth to acid. So it helps us create an alkaline environment, which is inhospitable to pathogenic bacteria. So there's a lot of reasons why we included xylitol in the formula. Probably the most, I think the biggest result from this is that it actually has a very pleasant flavor.
It has a great taste, actually. And it's funny because we were sitting here when we're doing some of the filming for this, we're actually both sitting here spraying it over and over. It tastes so good. It's almost addictive. So.
Yeah. And so that's one of the reasons that xylitol has such a powerful impact as well. So, for many patients, we recognize, like you mentioned, kids, decay in children is the #1 childhood disease. It's 5 times more prevalent than asthma, which is the #2. So our kids, our patients desperately need these products. And how many times have moms come in just super frustrated that no matter what they do, their kids are always having cavities. So it's really nice to be able to have something that can help reduce the stress in the mom by giving them tools that actually are having an impact day to day.
And it's something you can give a child that's it's so easy to use. You give them their little spritz, you give them their little thing, they get to take it to school, they get to use it on the bus, they have something to eat that in the past, right, it's going to create that acidic environment in the mouth. Well, it's a simple little thing. They just spray it in, the environment's more basic, so we've now neutralized that environment. We're reducing the pathogenicity and wiping out microbes that are causing decay in the first place. So you've given them a tool to use anytime, anywhere. That to me is just magical as a parent. I love that idea. So that was really kind of the vision. What can we deliver to people that's scientifically been proven to work, that is powerful, that is safe, and can be used anytime, anywhere to amplify you as a healthcare provider or an individual? It can give you a tool to be used anywhere.
I love it.